Well, thank you for joining us for the Medical Marijuana and Wellness webinar series. Tonight's topic will be pain management. And this is a seminar we've done in the past, and one that's really fairly popular. Obviously, pain management is one of the main reasons why people use medical cannabis. And there's a lot of confusion about whether it works, it doesn't work, how does it work. And tonight we want to answer a lot of your questions about that, and also to be able to have you be able to not only just get your questions answered, but get some information that might be able to help you with this webinar series. As everybody knows, let me just show you from our, let me go to the presentation here. I'm going to go to the presentation and start that so that we can cover a few items as we go along. So tonight's webinar series is brought to you, is going to be brought to you by myself and Dr. Terel Newton. He's the medical director for Trulieve. He'll be joining us in just a moment. I do want to point out a couple of things. First of all, this is part of a webinar series, which you can see over here. We have a number of other topics coming up, which is arthritis, sleep, routes of administration, migraines, cannabinoids, and terpenes coming forward. And tonight's webinar is designed to really be able to help you get your questions answered. And so please feel free to ask us questions. We're here to help you. And we're actually here to be able to hopefully provide you some information about pain management. And to that end, Dr. Newton, thank you very much for joining us. You'll be co-hosting it. I know you were mentioning that it's important to point out that a lot of the information that we're doing here is really for information purposes. We're not trying to give medical advice, and naturally you want to have people to be able to consult their physicians for their medical advice. But I think the ability to be able to have a session where we have not only a doctor who's very well skilled in medical cannabis, but also in pain management, I think this is important to be able to provide people information and also allow them to be able to ask questions. So Dr. Newton, tell us a little bit about yourself and who you are and what you do.
Great. Yes. Thank you, Mark. Can you hear me okay? Is the volume coming through?
For me, it's good. It's going well. Thank you.
Okay, great. Thank you. Yes, I'm a board certified anesthesiologist. I'm also trained in interventional pain management. So I focus on a variety of treatments for patients dealing with acute and chronic pain. So that could be anything from recommending physical therapy, recommending chiropractic care, performing injections myself, which I do in the office, also recommending a variety of medications, also sometimes referring patients to psychiatrists if they're dealing with depression, anxiety, PTSD, other symptoms. And then also working with the community to provide a lot of educational opportunities, not just for physicians, but also for patients, for other healthcare professionals. And so I try to travel as much as I can to provide, different types of educational resources, from anything from coming to speaking at events to providing some of our educational materials. And so I really enjoy what I do. I'm a big advocate for education and try to offer patients a more balanced approach in order to receive, good outcomes in their pain control. Today, I'm actually down here in South Florida. So I had a chance to visit a couple of our dispensary locations in Fort Lauderdale and Dania, Florida. So it's my first time, visiting those locations here in the last few weeks. And today it was just wonderful to be down and see some of our locations and, meet with some of the patients there and talk with some of our educators as well as our operators there, the office managers. So it's nice to be down here in South Florida to get a different view of things here.
As I mentioned to you, when you and I have talked, one of the reasons why, you asked me why I do these webinars, I really haven't been doing seminars and webinars literally for the last 4 years. Our goal is really to have people be able to get their life back. What we found with medical cannabis is, you have a certain medical condition that you're trying to address, and this will actually put it into a state where you can get most of your life back. It may not cure it, it may not completely solve it, but allows you to live a life as close to normal as you possibly can. And I think that's one of the goals that at least I have with this webinar. If we can just have one person get their life back, we'll be successful at what we do. And we hope that's you. We hope that's the person that's watching that's out there. I should point out that this webinar is being broadcast on Facebook simultaneously. And then additionally, I do want to point out that at the end of the webinar, you will be getting, let me go down here, you will be getting an email that has a recording of the webinar itself. So you'll be able to review it if you want to. You get a copy of the presentation. And that's important because sometimes these webinars are hard. They're like drinking water out of a fire hose, and trying to keep notes is very difficult. So what we're trying to do is provide you the information. So you will get the notes and the slides. Naturally, we'll have a list of all the sponsor discounts and all the speaker information and resources we needed to be able to get this done. So you will get a good follow-up email that follows that up. And I do want to point out a couple of logistic items. First of all, right down here, you'll see a little double, looks like a double bubble. It says Q&A. That's the Q&A box. And please feel free to ask questions. That's what we're here for. We really want to be able to answer your questions. There is a chat box. The chat box is more like over here. We do monitor that, but really it's the Q&A box that we really pay a really close attention to. And we want to be able to have you be able to funnel your questions through there. So Dr. Newton, with that being said, let's talk about pain. It's one of the top conditions in the United States cited for long-term disability, but tell me, what is pain from your perspective?
Yeah, so we have actually an evolution of the definition of pain, to anything from being an unpleasant sensory and emotional experience to being a sensory experience. And the most accurate definition is the one that we use currently. And that's where pain is an unpleasant sensory and emotional experience. Specifically for chronic pain, it's important because chronic pain is very different from acute pain. So when patients feel physical pain, when they feel emotional pain, these are the different types of things that we can address for that. And so after the healing process of an acute injury, sometimes pain persists. And this is where we're getting into chronic pain being a nerve dysfunction. And so the nerve keeps firing, even though there's no ongoing damage, there's no ongoing, stimulus for the pain, but the pain can continue. And we see that in about 30%, with regard to lower back pain. And as the population ages, you start to see more knee pain, osteoarthritis, chronic neck pain, different conditions. Being here in South Florida, people are driving crazy. I mean, I saw a few people racing, and unfortunately there was a couple accidents in the area. And with the severity of a severe injury, patients can have anything from spinal cord damage to disc herniations. And so there's a variety of types of pain like that. There's other types of pain like shingles is another type of pain. And these are chronic painful conditions that originate from different areas. We'll get a little, okay, perfect. That this slide here where it talks about an unpleasant sensory and emotional experience, some patients experience it more on the sensory side. So on the pain level 0 to 10, some patients experience it more on the emotional side. And so that's where you can have problems with sleep, problems with eating. It can lead to mood disorders, anxiety, depression, PTSD. Patients can feel overwhelmed and just be stressed out. So cannabis is unique in that it can address several issues, not just the sensory side of pain, but also the emotional experience.
Good. And, and interesting when you look at a person that's in pain, this is somebody that your body changes. We talk about your heart rate going up. We talk about your blood pressure going up. You may start sweating. You feel anxious. You can feel that that something is really changed. And it's something it's very hard to lead a normal life when you're going through that particular experience that's out there. I know there's a positive side of it that leads to the fight, flight, or freeze kind of a syndrome. But on the other side of the coin, pain is something that a lot of people not only want to manage, but it also helps you get to a point where you can enjoy your life and lead a normal life.
And some patients enter into something called a pain cycle. So the pain causes decreased movement and deconditioning that leads to more spasms, and the spasms lead to more pain. And so then the pain leads to more deconditioning and less movement, and that leads to more spasms, and that leads to more pain. So it's a cycle, a vicious cycle that we hope to interrupt. And we can actually do that several ways, which we'll get to toward the end.
Right. Well, and then also you hear the terms chronic and acute pain. And I know that at least I had some doctors when I first came to Orlando, a little over a decade ago. I had chronic pain, and I had a doctor tell me that there is no such thing as chronic pain. And I told him, well, jump in my body and you can experience it for a little while. I found that in my case, it was because I had more than one condition. And, if you're trying to diagnose it as one condition, it's tough. But, I had bad knees, I had bad back. I'm getting old, I guess at my age, if I wasn't doing the webinars, I'd be in a glue factory, kind of thing. But seriously, I think that both acute and chronic pain have different, let's just say, reasons why they exist, but they still equal pain.
Yeah, and I never understood the term acute pain because it's not cute at all. It's not pretty when you're hurting.
That's a good point.
So,
that's an excellent point. Yeah.
Acute pain is sometimes called fast pain. So if you're walking and you stub your toe, you step on a nail, that pain signal comes really quickly. chronic pain is more of like a deep burning pain. And that's what develops over time from the nerve dysfunction. Depending on what textbooks you read, you might see 3 months and more being defined for chronic pain. Some books might list 3 to 6 months, but the main thing is that you're leading into a nerve dysfunction when you get into chronic pain. And so then there's also something called acute on chronic pain. So if somebody has disc herniations and they have long-term standing pain from that hasn't healed, or disc degeneration, and then they can get an acute increase in that.
Yeah.
So then you can have acute on chronic pain. There's also another category, it's not listed here, it's called subacute, and that's kind of in between the acute and the chronic phase. So that's usually a period of 1 to 2 months. And so it's a transition process. But the earlier you intervene on acute pain, the less likely it is to become chronic. So if somebody's hurting very severely early on, you try to bring that pain number down as quickly as possible to decrease the risk of becoming a chronic pain patient.
Sure, that's out there. I know that it's something that the faster you address the pain and the earlier you realize it's there, it helps. There's an old theory that says the best way to solve a problem is to recognize that you have one.
Yeah.
And I know a lot of times you put that off and you don't want to admit it and you just don't want to worry about it. And then eventually it leads to a point where you got a problem and you got to address it. And I think a lot of people try to do that with pain. Don't worry, I'll tough it out, especially guys, we're going to tough it out. And then we find out that we shouldn't have toughed it out. Let's put it that way. We should have said something.
Well, one thing I wanted to mention about the emotional experience. So there's research that when patients undergo amputations, if in the recovery room they see where their leg is amputated, they're more likely to have phantom pain. But one thing that could be done is in the recovery room, attach a prosthesis, or don't let the patient see that their leg is amputated, because that's one of the emotional sides that links to the sensory experience. And so the more you can get pain control there and reduce anxiety, the less likely a patient is to have chronic pain. So you see that with diabetics, if they get a foot amputated. You also see that with various infections, one called osteomyelitis, where there's an infection in the bone, then the foot or leg has to be amputated. But there's so many ways that we can intervene and prevent the acute pain to becoming chronic severe pain.
Right.
So
now,
as you mentioned, chronic pain is the #1 reason for cannabis patients to use this medicine. And I like how you have on that slide, the 62% of patients use medical marijuana for pain management, but then a lot of those patients are also using it for anxiety, also using it for insomnia, also using it for other reasons. So those are like secondary health benefits or positive side effects.
Yeah, like arthritis, for example. It's something that really helps it out there. But I think also one of the things about cannabis and chronic pain is it's a lot safer than a lot of the medications that are what we would classically call pharma medications. I know that when I had my knee operated on, I had Percocet, and that's obviously wasn't very good for the first couple of days. That left me with a little bit of its own issues, but I stopped using that and went to medical cannabis. But I know a lot of people, when you take Advil, ibuprofen, and those things, especially over an extended period of time, that's not really good for your body, right?
It's pretty bad, because one of the problems is it reduces the protective lining of the stomach. If you take too much ibuprofen or anti-inflammatories, it actually decreases something called prostaglandins, which are protective mechanisms to help reduce the erosion of the stomach. And so with cannabis, it's actually in many cases a more potent anti-inflammatory, depending on what chemovar, what concentration that you get of the terpenes and cannabinoids. Not only is it stronger, it's also much safer. The use of ibuprofen is one of the main reasons why patients go into the hospital, because of a medication. And there's thousands and thousands of ulcerations that happen, and it's one thing that's called peptic ulcer disease, where a patient could have an ulcer and not even know it. So now they have the pain in their stomach, and now they're taking more ibuprofen to reduce the pain in their stomach. Right. Cannabis does not have that side effect. Not any of the formulations have that side effect. And so it functions more potently and is also safer with regard to that. And I think we'll get more into the opioid epidemic as we go along here. But just looking at over-the-counter medications, cannabis is so much safer than that.
Yeah, I know. Let me go on to the next slide here for a second. Hold on, let me go here. I know that a lot of times when people think about pain and they think about the different alternatives, they think about all the negatives. For example, you mentioned opioids. Okay, the negatives that come with that. Taking ibuprofen, taking Advil for a long time, like you mentioned, hurts the stomach lining, hurts the liver, hurts the kidneys. I think cannabis is really something that doesn't have any of those characteristics. In fact, if anything, it's pretty safe to use it. Is that safe to say?
Yeah, yeah, and part of that is because with cannabis, you know, CBD and THC, the receptors that it attached to aren't in the brainstem, and
Mhm.
so you can't suppress somebody's breathing with cannabis like you can with muscle relaxants, like you can with opiates, like you can with sedative hypnotics, like you can with, you know, benzodiazepines and other anxiety medications.
Sure.
And the other layer of safety comes in, where patients take cannabis, they can wean down on the opiates. And there's multiple studies that have shown that when a state passes medical cannabis laws and the patients have that as an option, there's a 20 to 30% reduction in opioid related deaths. And that
Wow.
continues over the first few years.
Yeah, there's been a lot of discussion, I know, in the medical cannabis world about how cannabis is really an exit drug, not a gateway drug. And I think that's really true. It's really true. It's really helped a
You're
lot of people.
exiting opiates.
Pardon?
Exiting, the patient's exiting opiates, exiting benzodiazepines, exiting sedative hypnotics, Lunesta, Ambien, you know, things that can cause these, you know, side effects called parasomnias,
Mhm.
to where they think they're asleep, but they're actually awake and moving around. I don't know if you ever heard of patients going in, you know, having a side effect from Lunesta or Ambien and walking out in the street or stabbing someone
Oh,
because
really?
they're experiencing it as a memory. And so
Mhm.
they think it's a dream, but it's actually going on.
Wow.
It's something called a parasomnia. It's very, it's somewhat rare, but it's kind of interesting that, you know, whenever you start to manipulate the normal circadian, the sleep wake cycle, the
Mhm.
normal rhythm, you can have all these different effects. Not to mention, you know, things like narcolepsy and worsening sleep apnea, and other issues.
Wow. Well, that's fascinating. I do know that, you know, again, the stigma of pain and a lot of negative treatments is there, and I think cannabis provides something that's first time you can get yourself something that's really a positive treatment, not a negative treatment in this particular case that's there. One of the other things that comes up here is it has been researched. You know, what kind of research is out there? And I know everybody knows it's a Schedule One drug. We don't do research here in the United States. Obviously, for it, we can't do research. We can do anecdotal studies, which is what the University of California did. McGill University, which is in Canada, can actually do studies because they can have the research up there. But there's also a number of other studies that we found being done around the world. It's probably one of the top studied uses for cannabis, I think, around the world. Is that safe to say?
Oh, yeah, absolutely. And there's actually been an exponential increase in research. So if you go to pubmed.gov, the National Library of Health, what you'll find is that because more and more states are passing medical cannabis laws, now there's more patients that can contribute to that data. I did a study with Geisinger University, they're out of Pennsylvania, and we looked at cannabis to help patients wean down on opiates, wean down on sedative hypnotics, benzodiazepines, muscle relaxants, and anti-inflammatories. There
Yeah.
are a lot of studies that shows that it helps with neuropathic pain. So pain from nerve damage, and that's nerve damage from the central, meaning the brain or spinal cord, or the peripheral, so the nerves that come out to the extremities.
Mhm.
And it's very good for that. Also for diabetic neuropathy.
Yeah.
And there's a variety of routes that the patient can even take to get benefit as well. So it's just amazing the different types of pain that it can help, and also the different routes where the patient can take their medication based on their preference.
Yeah, and one of the studies that was done in 2019 said 80% of the participants found it was extremely helpful in reducing pain. I think when we were doing the practice session, we were commenting about it, there isn't, you know, a lot of the drugs done with pharma companies don't come anywhere near that as far as the success rate.
That's unheard of in medicine. To have an 80% success rate, like that's just crazy. Like that's so amazing. You know, a lot of studies base success off of 30% or more. Some use 50% or more, but to see something that where 80% of patients are finding it very or extremely helpful,
Right.
like, you know, if they included the number of patients that had it, said it was mildly helpful, who knows, that might be 90%, you know,
Right.
helpful to some degree. Now, these are very or extremely helpful. So that's just amazing. And then when patients have the variety in, they can choose medicine based on their preference, I
Mhm.
think those numbers come even higher
Right.
because the patient is more likely to take the medicine when they can take it the preferred route. And it's something that fits their lifestyle, something that fits the strength that they need. You know, the different options and different ways to take cannabis is very unique. You know, muscle relaxants, we don't have that versatility. You know, we can just prescribe a pill. Anti-inflammatory is the same way. You know, topicals, you know, we don't have all those varieties like we do with the medical marijuana recommendation. And patients are more likely to be compliant when they can choose and have some say so in their care.
You know, we talked about research, and I think research is really important. And I'm not going to go over each of the different, you know, research studies done here. It'll be included in the packet when you get the email after this webinar. But there's been a lot of research going on for a long time. That's the reason we put this slide together. This isn't like two guys in a corner deciding that cannabis was cool for pain. There's been a lot of research by a lot of very well-known people. And most of it, though, being done outside the United States because of the fact cannabis is a Schedule I drug. But all of them have very similar results to what we saw earlier about, you know, better than 70%, 80%, 90% of the patients claiming that they've got relief from the pain in these studies, which I find very, very interesting.
Yes, and all these studies can be found on PubMed as well, you know, as well as at the end of the presentation. I think it's good to stay up on the latest area of research. So, you know, check once a month and look how many more studies have been produced, and you'll literally see that exponential increase over the last few years. Yeah, I think wasn't there a quote that you said that over the last few years there's been more cannabis studies than it had been for the 100 years before?
I just finished a course. I got a certificate in cannabis and in cannabis medicine, and also in healthcare, cannabis healthcare. And during the course, one of the classes was on research, and one of the professors was mentioning that in the last 18 months, they've done as much research into medical cannabis as they had in all the years before that. That's how much it's ramping up. And I think that has to do with a couple of different factors. A lot of countries are now taking the lid off of the prohibition. They're making it legal. There's more people involved, more countries involved. I think a lot of people have now realized that it's something that can in fact help, and they want to know why. I mean, I'm an engineer by trade. I'm a computer scientist, and where I got involved in medical cannabis, I researched it. I wanted to know if it really worked and didn't work, and more importantly, why. And I think people are starting to look at that, and that's what we're beginning to see is, you know, it's not just a matter of, yeah, this can help me, but why and what's the best routes to be able to use to be able to get the relief that you're looking for pain. There's been a tremendous amount of that. You know, what I'd like to do is maybe break for a second.
Yeah, absolutely.
Sanjay Gupta put together a really cool video, and I thought it'd be something we ought to play to take a look at what Sanjay Gupta said about pain. He did a series of 4 programs on cannabis, and this is Weed from the Weed 4 program.
Okay.
THC, which is the psychedelic component of cannabis, which makes you feel high. And then there is CBD, cannabidiol, the non-psychoactive chemical. We've told you about this one for years, especially how it stops chronic epileptic seizures in young children. There is also research showing that CBD is particularly helpful when it comes to pain. In fact, CBD can do something opioids cannot.
With opiates, you're talking about killing the pain, masking the pain, you're done.
Dr. Julie Holland edited the Pot Book, a complete guide to cannabis.
With medical cannabis, you're actually not just talking about decreasing pain, but you're decreasing inflammation.
That's because opioids do a good job of interfering with pain signals going to the brain. But cannabis works on 2 receptors, one that blocks that pain and one that decreases inflammation. It's ironic that cannabis can do more than opioids, yet prescription opioids are legal and cannabis is not. Historically, that was not the case. For centuries, both cannabis and poppy, 2 plants, the natural forms of marijuana and opioids, were commonly prescribed by doctors and dispensed at pharmacies. But that all changed in the 1930s. Opioids would go on to become a best-selling drug, and cannabis became increasingly fringe. In part because one kind of cannabis, called hemp, was a threat to big business. Hemp is a cheap fiber, good for making paper and canvas. It's more absorbent than cotton and could be used as a potential fuel.
So there were a lot of vested interests that sort of put cannabis down, took it away from the doctors, made it illegal.
I think we saw that basically it was more of a political decision than it was a how should I say, a scientific decision. From what I understand, Dr. Newton, that cannabis was part of the pharmacopoeia of the AMA up until 1938. Is that correct?
Yes. In the early 1900s, physicians could prescribe cannabis, and it was usually in the form of a tincture. And it was listed for hundreds of conditions, from asthma to headaches to menstrual cramps to pain after surgery to chronic pain. And so many conditions were listed there. And the first medical marijuana conference was in 1906 at Ohio State University. And so it was a part of our, what we call a armamentarium for different issues for patients, not just pain, but nausea, and, asthma, like that's amazing. And we'll get into later the mechanisms of how cannabis can be so versatile. And, I like the slide where you talk about, the whole medicine cabinet is like the whole pharmacy. And that's because you have so many different varieties of cannabinoids, but then a wide variety of terpenes and flavonoids. And what this is showing here is showing how there's so many different conditions that the cannabis can work toward. And we get an effect called the Entourage Effect when we combine a variety of cannabinoids with a variety of terpenes, and it gives a synergistic result. So you're giving one cannabinoid, adding one cannabinoid, it doesn't add up to 2, it adds up to 3. And that's because you're multiplying the benefits, you're multiplying the effects in a very positive way.
Right. And cannabis contains a number of, these are a couple of the cannabinoids that are in cannabis. And again, you'll be getting this slide and we'll be talking a little bit more about that. But there's a tremendous number of medical properties that are found in cannabis itself, which I find it's interesting. I don't think there's any other plant or any other medicine that has this particular, let's just say, this amount of medical properties. Are you aware of any?
Nope, it doesn't exist.
Yeah, exactly, it doesn't exist. And that's one of the reasons why, that's what makes cannabis so complex, is it does so much. It's
that's
fascinating.
we're on traditional medicine, it's really still stuck at, one disease, one medicine. We don't have the versatility. There's not the variety of cannabinoids and terpenes that you can combine in a variety of ways.
Right.
And so you lose that flexibility. Cannabis is not one medicine, it's not one chemovar or one strain, it's a variety. And patients can start with a low THC, high CBD, and have a very good experience working their way up to what works best for them.
Sure.
And so not only do you have the recommendation put in, patients can go back to the dispensary. And so they don't have to keep going back to the doctor saying, okay, that muscle relaxant didn't help, can I have a prescription for another one? And they come back again, that one didn't help, can I have a prescription for another one? With this recommendation, the patients can go back to the dispensary, say, and let the educators know, this did not work well with me, I might need to try something different. And you can troubleshoot and go through that trial and error. And that's just how medicine is. No one, no matter how much experience they have, they can't tell you, oh, this is going to work for you 100%, that's going to work for you 100%, because there's so many different factors. And medicine is not an exact science. It's not like mathematics or physics. Those are exact sciences, the same thing every time. You could even have two twins and have different metabolism, different body heats, different preferences, different conditions, different severity of pain, different severity of anxiety. And so there's no two patients are exactly alike, even when they are genetically the same. Right. And so you have to go and give the patient the option to go with their preferences. And, it all starts with education and letting the patient know that, this is a legitimate medication and we're treating a real medical problem. This is not all about just, taking medicine for fun. This is not recreational. Not that there's anything wrong with that, but this is a medicine and we have goals that we want to achieve and help you live a better quality of life in a more holistic way.
Yeah, I think that if you take a look at, let's talk a little bit about how cannabis works, because that really answers a lot of the questions about why it helps so many conditions in your body. I know that people are very aware of what they call the nervous system. We've talked about it. We all know about it. I call it the cell phone system for the body. It kind of lets the body know, what's going on between point A and point B. What I find interesting is when the nervous system says there's a problem, communicates to the brain and says, brain, Houston, we have a problem. The question is, what does Houston do about it? And that's where they found in they discovered this in 1940s, but it didn't come out until almost the 90s, the endocannabinoid system. Which your brain would tell the system, your body would say to the endocannabinoid system, we have a problem. And the endocannabinoid system would then look at what it could do to solve that problem or address that problem.
Yeah, that's a neat way to think of it, the cell phone, because it is all about communication. And so once your body receives that signal, it kicks in the endocannabinoid system. And actually, the cannabis in our body is made on demand. It's anandamide and 2-acylglycerol, all the actual molecules, anandamide and 2-acylglycerol. And so with this, taking the medicine, you can actually give yourself the cannabinoids faster than your body can make it, because they are produced on demand on as needed basis. Sure. And so in order to achieve steady state at a much faster rate, the patient can go ahead and take their plant-based cannabis, which is called the phytocannabinoids. And so they're supplementing what's in your body, which is the endocannabinoid system. And the majority of medicines, especially for pain, looking at the CBD, looking at the THC, they interact with various parts of our nervous system. It's very similar with seizures, where the nerves are firing, they keep sending a pain signal. This is where the CBD slows that down.
Right.
Okay? The same way it works with epilepsy is one of the mechanisms how it works with pain, but there's a whole bunch of other mechanisms. And as they said in the video, getting to the underlying problem, which is usually inflammation. So then you have your CBD helping with inflammation, your THC helping with inflammation, which, by the way, is stronger than hydrocortisone milligram for milligram. You have your terpenes helping with inflammation, and this helps you reach homeostasis, the steady state condition, much faster.
Right. I mean, our body is trying to put itself in a state of homeostasis. That's what the endocannabinoid system really is designed for. I mean, I'm just surprised it took so long for the medical community to really find it and recognize it. But what's interesting is, you mentioned earlier, our bodies are producing endocannabinoids over here. In essence, we are our own cannabis plant. If we think about it, we're producing these endocannabinoids. And in reality, what they found was that these phytocannabinoids, which is the product produced by cannabis, really is an identical structure to your endocannabinoids. In other words, it's something that matches the endocannabinoids, and it works very well with the receptors. It helps to replace it. And you might say, why would I want to do that? Well, I'll just take myself as a senior citizen. I'm a senior citizen. I'm not producing the endocannabinoids that I was when I was 20, 30, and 40. And so the question becomes, how do I be able to provide my body basically the resources it needs to be able to stay in homeostasis? And I think the other thing you pointed out, which very, very astutely, is it takes a while for my body to produce it. But if I'm able to have that cannabis stored, in essence, in my fatty acids, while it's being produced, they can actually your body can draw from those fatty acids and be able to start addressing the particular issue.
Yeah, one of the interesting areas of research that's being done now is not only as we age, but there's some patients that genetically they have low endocannabinoids. And so conditions like migraines is one of the causes of severe pain, debilitating pain, and it can be due to an endocannabinoid deficiency. Fibromyalgia is another condition that causes severe muscle pain. You can touch a patient very lightly, enough to blanch the skin, and it causes severe pain. And so it's basically a nerve sensitivity syndrome. For some patients, it's due to deficiency of the endocannabinoid system, for IBS as well. And so when we see cannabis and how it can interact with the GI tract and the immune system, it can give a lot of benefits for, you look at Crohn's disease, you look at IBS, there's so many conditions. If you supplement that endocannabinoid system, it's such a natural way to, provide medication. The synthetic opioids, the other issue with them is that, not only can a patient overdose, they tend to cause constipation. Cannabis is much more forgiving on the GI tract. You don't see things like constipation. You rarely see things like nausea, and it actually treats nausea. And so it's one of those things that, when we try to treat a patient, we're worried about, okay, yeah, there's a therapeutic index, meaning that you can actually kill the patient, but then also look at side effects. With cannabis, the side effects are much more mild when they do occur, and they often occur much less likely. A lower percentage of patients have those side effects.
Right. Well, that's and again, it goes back to it's a very natural process, but it's a very safe process. And I think that's what's really important for people to understand. We'll talk a little bit about the safety of it as we go along, but when we talk about cannabis, there's kind of two big cannabinoids that we hear a lot about, which are CBD and THC. Why don't you contrast that for us, and then why don't we talk, then we'll lead into talking about some other cannabinoids in the plant that might be helpful to be able to relieve pain. But tell me about THC and CBD.
Yeah, so CBD is cannabidiol. That's the non-euphoric component, and it's one of the most abundant cannabinoids. You often see it in hemp strains. In Florida, our definition of low THC cannabis is at least 10% or 10 milligrams of CBD and 0.8% and less of THC. So those products in that category, even though it's medical marijuana, the low THC is going to have CBD. And that works on receptors and immune system to reduce inflammation. It also helps with PTSD by interacting with our serotonin receptors. THC is a much more well-known cannabinoid, and that is psychoactive, but it has a lot of benefits in inflammation, with pain, and the other listed conditions, not to leave out cancer, of course, and they work very well together. I think of the cannabinoids as basically the power of the plant. And there's the other group, the terpenes, which gives cannabis that smell and the different colors, as that's the personality of the plant.
Right.
So what we're looking at is, ways to adjust our CBD and THC ratios in order that the patient get the best outcome.
Sure. I mean, you take a look at how cannabis, how did the plant evolve? It starts out as CBGA, and then those acids basically break down into THCA, CBGA, CBCA, and then it's heated, or basically with time, that's where the THC, the CBD, the CBGs are all get produced. So it's kind of morphs as far as the medical properties of the plant itself, down to the point where you then, with a lot of aging, that's where you get into the CBNs and the TH, the delta 8s and the CBLs and that type of thing that are out there.
Yeah, and this is one of the reasons why patients get much more immediate results when they smoke the medication, because they're converting the THCA to THC. And so they're getting that medicine not only in a higher absorption, so that's called bioavailability when you take your vape, but they're also getting the actual level of THC is more, because now you're decarboxylating, you're going from THCA to THC. So if you take your cannabis product and you leave it on the counter for a few months, over time, that THC will be converted to CBN. And so CBN is very good, not just for pain, but it's also good for sleep. So in some situations, you might find that the cannabis feels a little stronger, and that's over time, that's because the THCA is being converted to THC, and then some of the THC is converted to CBN.
Right. So I mean, it's an active plant. It's an active product that's out there. And I just wanted to point out that there's more than one cannabinoid in cannabis. I think there's been about 200 of them identified, and there's about 120 of them that are being studied. So it's something that is a medicine cabinet that's out there. But we had talked again in previous seminars or webinars and in practices, we talked about the fact that THC and CBD affect the CB1 and CB2 receptors in the body. CB1 receptors primarily are found again in the brain, and the CB2 receptors primarily in the central nervous system. And one's really good for, like you mentioned, a lot of the pain issues, which is what THC really addresses. CB2 receptors and CBD is really works well with that, and it really helps with inflammation. And obviously, as you relieve inflammation, you're relieving the pain. So it's well known for that. But CBD does more than work with the CB1 and CB2 receptors, right?
Yeah, so there's actually a research study that had come out that showed that there's over 70 interactions. And so it's not just the receptors, which are the proteins on the cell surface, but it's also interacting with transport channels, also interacting with enzymes. The majority of traditional medicines are going to either act on a receptor, so they're going to attach to a protein on a cell, or they're going to inhibit or speed up an enzyme. And so what has been shown is that CBD interacts with so many different varieties of receptors that's where we get many, many different types of benefits. So with PTSD and anxiety, we get benefit from interacting with the serotonin receptors. For blood pressure, get benefit from interacting with the GRP55 receptors. And so there's also a couple other receptors not listed on here. One is TVRP, that's associated with pain, especially neuropathic pain. So there's so many different varieties, and it's not just interacting with our own endocannabinoid system, but there's so many other layers to it, and we're just peeling back the layers and seeing the other mechanisms of how THC and CBD work to our benefit.
Right. And I think it's important to point out, we are just scratching the surface with respect to research into cannabis. I mean, this plant has a lot of potential. It has, the research has been almost stifled over the years. And of course, now the gloves are being taken off and there's a lot more research being done. But we are just beginning to realize the benefits of it and the different things it can do. So again, as you mentioned, recent studies are really finding out that CBD is a lot more important to our bodies than we really thought. So let's talk about the elephant in the room, Delta 8. Everybody talks about, well, we're gonna go out and grab some Delta 8.
Yeah.
It's gonna help me with my pain and everything.
It's not an elephant. It's not that big. Maybe like more like a hippo or a pig or or a hedgehog.
Yeah, I think everybody, there's what we call trends, and I think the Delta 8 is a trend. I don't know if it's trending, ending trending, or beginning trending, but Delta 8 is out there. What is Delta 8 and how does it compare?
Yeah. Can you go back a couple of slides to that one where we saw that the heat, helps with decarboxylate? I just want to show that this is something that occurs naturally. Yeah. So there you see at the bottom next to CBN Delta 8. Okay. Now you can go back to the other slide. I just wanted to show that this is something that does come from the natural plant, because there's some other products out there that you see on the retail market that are basically made synthetically and are not in any plant, in any plant-based components.
Right.
And so we have to encourage our patients to be careful and cautious with some of the retail products. There's so many products that are often even mislabeled, and so patient may be purchasing a retail Delta 8 product and there's no Delta 8 in there. The same thing with CBD. So there's a study that looked at retail products and to see the accuracy of labeling. And there's one that showed 60 to 70% of products are mislabeled, meaning they don't have what is there on the package, or they have more THC than they can legally have, which, they can't have more than 0.3% THC on the retail side.
Right.
So different companies are kind of bypassing these, rules and regulations in order to cut costs, but unfortunately it reduces safety. But Delta 8 and Delta 9 are both safe products. They do both come from the cannabis plant, and you see that they're in that same lineage as far as the pathway. Delta 8 is about 50 to 70% as strong as Delta 9 THC. And now you have to keep in mind that, when we talk about Marinol, that's just pure Delta 9 THC. That's very different from what we get in a plant, which has much more efficacy for pain, for cancer, for epilepsy, and the other conditions. When you look at pure THC, it's mostly just good for appetite and nausea. So Delta 8 is kind of similar. The functions, are on the same receptor, but what you can do is add Delta 8 to a regimen, and so a patient can get a more balanced cannabis experience. So the Delta 9 is going to attach strongly. The Delta 8 is also going to attach to a slightly lower efficacy, but it can give the patient a more mellow experience, especially when you combine with CBD as well. Those three plant-based products work very well together and give the patient a very smooth improvement in pain, smooth improvement in nausea, smooth improvement with, a variety of conditions that we're treating.
Yeah, I think we talked about the entourage effect. This is where CBD working with Delta 8, working with Delta 9 provides more benefit than the products actually by themselves in many cases. There. So when you talk about Delta 8, here's all the different things. It does a number of different things. It's a very positive thing with respect to, as a cannabinoid, it's very important and very positive to being able to help people address a number of different conditions, not just pain that's out there.
Yeah, we talked a little bit earlier about the GI tract. So 80% of our immune system is in the GI tract. So it's very important that, patients optimize nutrition for any condition, and we want to have patients focus on, treating their whole self. So not only just take your cannabis, also eat healthier. That's going to help your pain too, in a synergistic way. So with the Delta 8, just like with Delta 9, it's going to help with nausea and vomiting. Nausea is a huge side effect of opiates. It's going to help with appetite. It's going to help the brain in terms of being a neuroprotective agent. There's a patent that the National Institute of Health acquired in 1999 that showed that cannabinoids protect the brain from traumatic brain injuries. Following, pain, hangover help. I mean, that's not a qualifying condition, but I'm sure a lot of patients could use it for their hangover.
You'd like it to be, that's for sure.
Relaxation and sleep. So, I look at these, the ones that's listed there on the right side, I look at those as positive side effects of, Delta 8, which you can also see these with Delta 9 as well. And when you combine it with the proper terpenes, the patient can get an even better experience. And so what you look at is just a variety of ways to interact with the endocannabinoid receptors in our endocannabinoid system, where patients can get a variety of benefits, just like they can with THC and CBD.
Yeah, I mean, the reason that this slide is here is to show that when used properly, Delta 8 is something that's very effective. But the negative side of it is because it is something that has been isolated, been produced on its own, we get a number of what I will call bad actors that are not necessarily putting out quality Delta 8 products, if they're even Delta 8 products themselves. We have a lot of products that are mislabeled. I know that that's one of the things. I talked to Holly Bell a few weeks ago, and that's one of the things that her department has been just literally fighting, is being able to make sure that the right products are labeled on the shelf that's out there. And it's something to be very careful of. The U.S. Council, the Cannabis Council, basically warns people, look at that label very carefully. I know that when I was preparing a cannabinoid webinar, I went to 5 different local shops in my area, not dispensaries, but just shops that sold Delta 8, looking for the labels, looking for what the certificate of authenticity was on that particular product, and only found that 2 of them had COAs.
Wow.
And what's even more important is out of the 2, one of them was out of date by 1.5 years, which meant that what was on in the bottle wasn't what was being presented that's out there. And that's where one of those things, this is what gives the industry a bad name. And unfortunately, we have a lot of bad actors that have come in here. I know that Florida's done a great job with the dispensaries like Trulieve to be able to make sure that you have not only the quality control, but your products do match. I mean, you do two in-house quality tests plus one test with a firm that's outside of Trulieve in order to put a product out the door.
Yeah, so we're confirming the contents, the cannabinoid and terpene profile, but also the safety of the product, that it's not contaminated with fungus, virus, heavy metals, things that can be found in the environment. You're more likely to see that with the hemp products because they're outdoor grows, and if there's heavy metals, arsenic in the soil, it's going to be taken up by the plant. The plant can't be selective and take up the nutrients that works best for it. It's going to take up the poisons in the soil as well. And so that's one of the things that is tested for on a certificate of lab analysis, that the patient's medicine is not only confirmed of exactly what it is, but it's also safe.
Yeah, and there are a number of good retailers, that do pay attention to their COAs and their certificates of authenticity, and there's people that will provide them for you. And a lot of people that are doing a good job, or they'll actually have them there. They'll show them to you, and they'll show you where to get them. If a person is saying, well, don't worry about it, this batch is taken care of and it comes from a quality vendor, see the proof in this particular case. I'd say this is one of those things where I'd be like, from Missouri, I want to see the results, because again, this has opened the door for a lot of bad actors, and it's created a bit of a problem. It's kind of a legal loophole, and there's a lot of bad actors that are jumping through that legal loophole. And that's all we want to point out. Delta 8 is safe, bought by the right people, using the right conditions. But
I want to mention that if any of the people watching want to see what one looks like, you can Google search Trulieve and certificate of lab analysis. You'll see some examples of those certificates will come up in your search, and you'll see the PDF documents of some of the products that we have.
So let's talk about how it works.
I just want to mention one other thing, is that when a patient is actually certified, they can at any time do a QR search. So there's a label there on every product, and they can just take a picture of it, get the QR code, it'll take them to the certificate of lab analysis. But
every one of your products has it right there. You can click on it and you can actually see it, which is really what you want. And by the way, what you'll notice is that COA is current, meaning it's something that's been done recently, like within the last 30 days type of thing, as opposed to some of the products I saw that were literally 1.5 years, almost 2 years old for their COAs, which means what's in the bottle isn't matching what's obviously the certificate they're presenting. So let's talk a little bit about, you talked about a little bit about how it works. We have our endocannabinoids, which our brain basically derives it. We have the photocannabinoids that come into our bodies. And then you mentioned the synthetic cannabinoids like Mirinol. I know that, we always believe that we can produce an apple or an orange or a peach in a lab, which we really can't. It's something that's there. You want to chat a little bit about that?
Yeah, so this is showing basically there's three sources where cannabinoids can come from. You know, within our bodies, the endocannabinoid system, so that's our nervous system and our immune system, the CB1 and CB2 receptors, and anandamide and glyceride and the fatty acids that you mentioned earlier. The plant-based cannabis, which is what we're talking about when we're giving them medical recommendations. And then there's the synthetic cannabinoids, which are made in the lab. And all of these types of cannabinoids interact on our same endocannabinoid system, but these are just different sources of where those cannabinoids can come from when we're supplementing what's in our body.
Now, what's interesting is when your endocannabinoid system takes these in, this is where they're regulating your appetite, your pain, your sleep, your pleasure. This really is the thing that puts your body. We talked about homeostasis. We talked about putting our body back in homeostasis. This is how it works, right?
Yeah, it works like that, but the synthetic cannabinoids don't do that. They don't return you to homeostasis because it's not balanced.
Right.
The other term for synthetic cannabinoids is exocannabinoids. Exo meaning from the outside.
Right. So basically, when we say Houston, we have a problem, right? What happens? You have taken some cannabis. That cannabis is stored in your fatty acids. Your body, your neurons say we have a problem. Your body then triggers those fatty acids, turns them into long chain fatty acids, and that's where it then produces the cannabinoids that actually then get sent to that part of your body to address that particular condition that's out there. So it's interesting where a lot of people perceive that the cannabis addresses the CB1 and CB2 receptors directly. It really doesn't. It's a process that your body uses to be able to identify the problem, figure out what the best solution is, and then provide that solution to your body basically through natural means. Now, what's fascinating about this is it explains a couple of things. It explains why the entourage effect works. Entourage effect to me not only is just the fact that they work together more powerfully than by themselves, but also in certain cases we have patients who will take it, for example, for arthritis, and what they'll find out is that their glaucoma goes away. And your body doesn't need a doctor to tell you that you have a problem. Your body knows you have a problem. It'll then produce the endocannabinoids to be able to address it, and it'll be able to go after that problem, even though that wasn't the reason that you took cannabis. There's a number of different issues in your body that cannabis can address: pains, inflammation, glaucoma, arthritis, in addition to whatever reason you're using for taking cannabis. And that's one of the reasons why it's so great for pain.
Yeah, as far as, the entourage effect, there's actually, some places in modern medicine where we see a similar effect where you combine oxycodone with acetaminophen, and, that combination would give, improved results over oxycodone and acetaminophen taken separately. The same thing for a lot of the migraine medicines. You might see, aspirin combined with caffeine, may give a better result than if they were taken individually. So with this, we have the cannabinoids, which we talked about earlier, and the new one for a lot of patients might be that delta 8. So we have CBD, delta 9 THC, and then delta 8 THC. Combine any of those and you get better results. But then also you can add in terpenes. Right. So terpenes are what gives cannabis the different flavors, colors, and this gives the personality to the plant. So why does one chemovar, one strain look purple and another one look reddish and another one look green? And that's usually because of the terpenes. And there's different types of terpenes, which we'll get into a second. But if you combine CBD with linalool, for example, that helps with anxiety, you get a much better result than if you just took them individually. And so one of the reasons that happens is because when you take a medicine, it doesn't just attach to that one receptor and then it's gone. It might attach to the receptor, then release, and then attach to another receptor, then release. So that medicine's still hanging around. So it has something called a half-life. And that's the time that it takes for your body to get rid of half of it. And so if one is affecting one pathway and one is affecting another, you can get a synergistic result. And so it's much better than just adding one and one. And so the results are multiplied. And so that's where we say sometimes 1 + 1 equals more than 2. And this is the entourage effect.
Yeah. And I know, for example, if you're looking at dosing, you're looking at figuring out what the right dosing method is for you. If you have some CBD around and you take, let's say you take too much THC, you can actually take some additional CBD and it'll actually bring you back down, right? It'll actually help you be able to, what they call rescue.
Yeah, it's good to have that extra CBD handy, and especially in, you know, a vape form or a tincture, because you're going to get a much faster onset. So if a patient, you know, accidentally took too much of an edible and they need to be calmed down a little bit, the CBD will actually help that. It'll counteract those side effects of the THC.
Sure, that are there. So let's see.
I don't know if you heard about that story where the police officer and his wife were trying some edibles, and they called 911, and they were talking to the dispatcher, and they said, "Well, I think we're dead." It's like, "Honey, are we dead?" She's like, "Yeah, we're dead. We're dead." And, and so the dispatcher was like, "Look, you just calm down. Did you take something? What were you doing?" And so he admitted to taking the cannabis, and they took too much edibles.
Yeah.
And then they thought they were dead. And so it's like, okay, they didn't have any CBD handy. If she had known, maybe she could have walked them through, you know, taking some CBD to get the paranoia to calm down.
And a lot of people don't know that. I know that in talking to a number of doctors, they talk about, you know, chew black pepper or just wait it out. I don't know about you, chewing black pepper might be a little rough around the edges for me. But I think having some CBD and being able to take that helps you be able to stay that balance and not have to worry about the potential negative side effects of THC that people have.
And that works because beta carotene, which is a terpene, it's not structurally like a cannabinoid, but the way it functions, it interacts with CB2 receptors just like CBD does.
Yeah.
So that's one of the tricks and methods where you can do that. Another thing to note is that if patients are having problems with memory, you know, alpha pinene, you know, can be added to help reduce problems with memory. So for Alzheimer's patients, you know, having CBD, which is a neuroprotectant, reduce the inflammation in the brain, and their inflammation is called neurofibrillary tangles. So CBD can reduce the inflammation, and alpha pinene can increase the patient's acetylcholine to help the memory.
Oh, really cool. So let's talk a little bit about, let's talk a little bit about cannabis itself. I know that when I got involved in the industry about 10 years ago, and in fact, when I was a kid going to college, all I heard about was sativa and indica. And that was kind of the world of cannabis at that point in time, which I think physically they're different. I mean, I've been to your grow facilities. They are different. They do look different. The bushes themselves look somewhat different. But it's very interesting that our world it started out as a sativa and indica world. As far as
And, you know, when you look at the origin of cannabis in different geographic areas, you know, there was a distinct phenotype or way that the plant appeared. So in some areas, the cannabis plant was tall with narrow leaves, and it tended to have more uplifting effects. And in some geographic areas, the plants were shorter, they had broader leaves and tended to have more relaxing effect. And so that was more in colder environments. And so these are what's called the landrace strains. So this is how the plants grew out of the earth as God made them. And then over time, we combine the sativa plant and the indica plant to something called hybrids. And so most of the medicines today are hybrids. So they're blends of the sativa and indica. So you can get the various effects. And when we look at different medicines that's available for patients, we can use that knowledge to cater to what the patient needs. So if they need a more uplifting effect, they can get one type of medicine. If they need a more relaxing effect, we can get another type of medication. But these are, you know, to an extent historical things, but then also they can also be used today when we talk about the effect that the patient wants. Do they want to be uplifted? Do they want to feel relaxed? Do they want to feel more mellow, like to go into sleep? And so this is just some of the terminology that we use. In our conferences, we don't generally use these terms. We use the term chemovar in a conference. You know, cultivar is another term. And at Trulieve, there's a collection that we have, you know, when we want to get a more precise fingerprint, when we want to cater the patient's experience and more personalize it, you know, they can go to the community educator. They can come actually set an appointment and come into the dispensary and learn more about the medicines, whether they're a patient with us or not. You know, they don't necessarily have to have their card. They can always, you know, look up the website and schedule a consultation and learn more about the products that's available.
Yeah, I think you brought up a very good point. You know, I think when we started with the sativas and the indicas, what we found out by really finding out about the different cannabinoids over the last, let's say the last decade, what they can do and how they work. But we also discovered something very important called terpenes. I think we overlooked terpenes for a long time. And what we found out is the terpenes, I think you mentioned this is the GPS. This is the thing that guides it. This is what really brings the relief home for you. And I think as we started realizing the combination of the cannabinoids and the terpenes, that's where you get to what you would call the cultivars or the chemotypes. But also that really defines the fingerprint. What is it going to do? What do we want it to do? I mean, where we are right now is at a point where we're discovering a lot of this, putting out a lot of plants. We know it's there. But I would say probably in about 10 years, we'll actually have the products being built or being developed and available for very specific conditions. That's kind of where we're headed.
Yeah, for example, for cancer, there's multiple studies that look at D-limonene. And there's even a more recent one that looked at it for breast cancer. And it's been shown to delay, and this was in humans. Look at it showed the progression was delayed. And so the survival time for breast cancer patients was much longer. It's also been looked at in some rat studies as well for gastrointestinal cancers to slow the progression of those as well. So at some point, we will be able to combine that with the cannabinoids, which work by a different mechanism. One is called apoptosis, which is a programmed cell death. And so the cell basically breaks apart into small pieces with apoptosis. And then some cannabinoids and also some terpenes induce something called anti-angiogenesis. So cancers grow fast because they form their own blood supply. And there's some cannabinoids and terpenes that actually block that. And that slows the progression, slows the spread of the cancer. And THC, to some extent, can prevent metastasis. So there's different enzymes that the cancer releases to help it spread to other areas and attach to other parts of the body. And so THC combined with other cannabinoids, combined with terpenes, at some point we'll be able to cater the patient basically what type of cancer they have, what type of subtype, what terpenes, what cannabinoids do they need. The same thing for epilepsy. At some point we'll be able to see, okay, this patient has a genetic type of epilepsy. What's the best type of CBD? What's the best type of terpene to give them a good entourage effect?
Right. And this is where we call it what we call the sweet spot. This is what dosing is all about. How do we have the lowest dose that gives you the most positive experience with respect to being able to address your particular condition that's out there without the negative side effects? I think that's what we're looking at. When we talk about dosing, that's where we're headed with this whole thing. But I really like the concept of the chemovars, and I love the concept of your cultivar collection, because what you're really doing is trying to identify what it can do for you. I'm a big believer in what's in it for me. I can take a look at this and know that this is what I'll take to help me with that particular condition.
Well, I'm a big believer in patient preference. We can, can you advance that? I want to show this next slide here because this is what makes cannabis so different from any other traditional medicine, is that patients have options. They have a variety of ways to take the medicine. And if they need immediate relief, inhalation is a great route. So they can take the vapor pen, they can take a concentrate, whole flower, and you see the onset time immediately. And so it's like taking an inhaler. So when you take an inhaler, you're going to get benefit within 1 minute or 2 minutes. Looking at sublingual, that's going to work very quickly as well. If you've ever seen nitroglycerin, where somebody would take under the tongue if they're having a heart attack, because that bypasses liver metabolism just like inhalation. So that's going to work very fast as well. That's going to work within about 20 minutes. For oral, whether you're talking about capsules or edibles, that's going to take a little bit more time, sometimes 2 hours. And this is the one where we want patients to be careful, be patient when you're starting out, so you don't take too much and you know that it's going to work in 2 hours. So I like people to remember the twos and help them remember the onset. So inhalation is 2 minutes, sublingual is 20 minutes, oral is 2 hours. So if you remember the twos, then you know what to expect and how fast your medicine is going to help you.
Well, one of the things about oral medicines is about the time you think they're not working and you take another one is about the time they start working. And that has to do a lot with edibles. I know that, you have to have patience when you're looking into the oral area, especially with edibles. Because, and first of all, the edibles taste good. If you get into the, you get into the gummies, you get into the cookies and all that stuff, they're pretty good. I mean, the days of having some bad tasting cannabis in your edibles is gone. And the temptation to take another one's there. But more importantly, if after maybe 15 minutes or 20 minutes, they don't work, you're tempted to take another one, where if you wait another 20 minutes or so, you'll get the effect that you want.
Yeah, that's actually, the gels is actually one of the best selling products and patients just love it. It tastes good, it's palatable, it works, it's effective. and there's no like guessing game. You know, once you find your sweet spot, literally and figuratively, you know, patients just really enjoy it, and you know, they become a testimony. You know, they become a living testimony to what the medicine can do. On here on topicals, I find topicals to be fairly variable. So you have some patients like your rheumatoid arthritis patients that can apply a topical, and if there's a good amount of THC and CBD and terpenes in there, they can see some results within 12 hours. Actually, the swelling is coming down. Some patients need to dose topicals for a few days to maximize the results. So if you're looking at large joints, or you're talking about the knee, the elbow, wrist, it may take a little longer. But for the small joints, the fingers and toes, the rheumatoid arthritis patients, they get very quick results with their topical medications.
Right. And it's important to point out you can mix and match. I know in my particular case, I have 7 herniated discs in my neck, which is no picnic. And when I wake up in the morning, I'm in pain, the best way of putting it. I have on my nightstand, I have sublingual drops, which I do take. In my case, they take about 20 to 25 minutes to work. But I also have a vape pen that's right there. And I grab the vape pen and take potentially 1 to 2 hits off the vape pen. And my pain level will go from wherever it was down to a 1. I mean, almost immediately, I think within a minute or 2. And the first time that happens is just remarkable. I mean, the first time that happened, I just was really, really amazed. This morning when I did it, I was really amazed. But you can mix and match these, so I can get my relief right now while my sublinguals are kicking in. And the only thing I have to pay attention to is my oral, or excuse me, my sublingual will last about 4 to 6 hours. So if I take it in the morning, I've got to do something in the middle of the afternoon. And if I do that, I have to take something in the evening, because in my case, where I have constant pain from my neck, it's not going to go away. It'll come back and remind me that it's there. And I don't want that to be midnight or 2 o'clock in the morning. That there. Now you mentioned topicals. I'm a big fan of topicals. I think they work, but I think you're right. You have to get the right topicals, quality topicals that do have the capability to be able to be transdermal, which means it can get past the dermis and get right into your bloodstream. So let's talk about the various. This is a quick chart. We don't really want to run through this. I think we covered a lot of the main points. This is mainly provided for information, but there's, as you mentioned, this is cannabis is a personalized experience. You can personalize it for yourself and make it something that you yourself want to do, and that's what's important.
Yeah, so looking here, going down, I just wanted us to go real quickly down that list. So, you know, sublingual drops are also known as tinctures. These were the medicines that were available in the early 1900s. They're mostly tinctures. You know, inhalation is the vape pen, capsules, and edibles we talked about before. Topicals is one way to get the medicine in through the skin. The other one is transdermal patches. Meter dose inhalers, that's most familiar to us as asthmatics, as a medicine that an asthma patient would take, but it's also available in CBD, THC, and the full complement of medications that's available for medical marijuana patients. Sprays is generally talking about sprays that will go in the mouth, so either under the tongue or oral mucosal, so on the side of the cheek. Of course, flower is very versatile. The dry flower can be smoked. It could also be taken as a tea based on your physician's recommendations. And then concentrates are for the more experienced patients where they may need something stronger, more potent. Concentrates are also very good for cancer patients. So in order to intervene on something that's spread into other areas, you would need a higher dose. So we have, you know, different, you know, products that's geared toward the concentrated area where patients may need more medicine.
Sure, sure. And I think also concentrates also, I know when you light up a joint, you have a 500-degree flame that burns off about half of the cannabinoids, all of the terpenes and alpha flavonoids. So your medical benefit is about 1/3 of what you really should be getting from that cannabis cigarette. But what's interesting is it still is a powerful medicine that helps a lot of people. That's what I find just absolutely amazing. When you get to using the concentrates, what you do is you have basically the same products, but it's maintaining a lot of the terpenes. It's maintaining a lot of the flavonoids. And when you get into using rosin and resin in vape pens, you know, in these things, it really is effective. And that's why a lot of people, especially experienced cannabis users, really turn to that, both not only for the medical relief, but also for the cost. It's a lot more cost effective.
Mm-hmm. Do you want to take some questions?
Yeah, let's take some questions.
Okay.
Let's see. One of the questions that came up here is says, I always wanted to know where were the cons of flower smoked when it comes to lung health. I've read numerous articles about how it's different from cigarette smoke, but I've also, it's also been stated being worse on the lungs compared to cigarette smoke. What's your thoughts about that?
Yeah, so, unfortunately, there were some retail products that caused a mysterious lung disease, and it led to inflammatory lung conditions in some patients. And that's because the way that the oil was prepared, which was in, often with vitamin E or other types of oils that can cause damage to the lung when they're burned. So when you look at carcinogens, you think about smoked foods, you think about grilled foods. There has been association of consuming those foods that have carcinogens when they've been grilled or smoked for a long time. And that's because when you convert the iron component in hemoglobin and myoglobin, and you heat that up and grill it, it actually causes free radicals. And so with smoking, it's something very similar. So anytime you're burning something, it can create free radicals, and that is what could lead to some degree of lung damage. The problem with some of the over-the-counter products is that, when they're large complex molecules and they were breaking down to many free radicals. So, with smoking, there's been several studies, actually one out of Harvard, that showed that cannabis smokers have a lower rate of lung cancer. And that was reproduced in another university. Whenever you talk about smoking, it can affect lung health because you're taking something into your lungs that's being burned. But as far as the overall risk, is relatively low. When you compare it to tobacco, there's really not a good comparison because cannabis has so many anti-inflammatories that are neutralizing free radicals. And Marc, what you had mentioned earlier is a good point to tie into the answer to this question, where you talked about the heat that you use. And we talked a little bit about this last time on the dosing presentation, and that you don't have to necessarily combust a product. You can heat it up till it enters a vapor and then breathe it in. So there is a lot more versatility, to flower, to as well, where they can be vaped. So you do have a variety of ways to take the medicine. It doesn't necessarily have to be smoking if a patient is concerned about the lung health.
Yeah. And I think, again, you're talking about two different things between cigarettes and cannabis. It is going into the lungs, but just like, we've all dealt with, we've all heard of asthmatic inhalers for a long time as something that's positive. That's fundamentally what we're talking about here, is something that really complements the lungs and not necessarily something that's causing a problem for it. Let's take another question. I think one that says, are there any prescription meds that should be avoided when using medical cannabis?
There's not necessarily anything that needs to be completely avoided. There are certain things that should be watched and monitored by the prescribing physician. One example is CBD and blood thinners. So if a patient is on a low dose of CBD and taking a blood thinner, the most likely thing is that there's not a significant interaction unless they're taking on the order of 400 to 600 milligrams. But again, that's something that will be monitored by your physician. The other thing that interacts with blood thinners is various foods and various, leafy green vegetables and things like that. So you may be told to consume the same amount on a daily basis, so that way you're at a steady state with those medicines. Right. The same can be true for anti-seizure drugs. So those are called anti-epileptic drugs. So you want to make sure that your body is at a steady state. So you're starting at a low dose and you're keeping the same dose over a period of time. With epilepsy, in order to reach a steady state in general, you're going to increase the dose over a period of a week. So you're going to be taking the medicine over a longer period of time before you make a dose adjustment and see how it's helping. So that's one of those things that, there's not necessarily an absolute contraindication. It's just things that you want to be cautious of.
Right. Well, and I think it's something that you're mentioning, something that's really interesting. You and your body are what you should be listening to, not necessarily your doctor. And I'm not trying to take the doctor out of the equation. Your doctor is looking and asking you the questions of how it affects you to be able to provide the best information to provide the relief that you really need. Your body will tell you what's working. Your body will tell you what's not working. I think that's important, to listen to your body. Now, we also had a question that came up. Beverly asked a question, says, I'm confused with which form of cannabis is best for me. I have tinctures, lozenges, and chews. I only take it at night, but I'm not sure how to determine which is best for me. You want to address that, or you want me to take that one?
Sure. Did she say what condition she's treating?
She unfortunately didn't say the condition. So
Okay.
Beverly, if you get a chance, why don't you type in the condition, if you don't mind, we'd appreciate that.
Okay. All right.
But
So
I think
one
when you
thing to
say
note
what's
that
best for you, I
all
think
have
what's
different
best for you is
onsets in terms of expecting relief.
yeah.
With the tincture is going to be the drops under the tongue. And as we mentioned earlier, it should be about 20-minute onset. But I do want to mention this, if you're taking it for a seizure disorder, you have to wait and get a steady state. With a lot of the neurologic conditions, MS might be another condition that a patient could take it for a neurologic reason. And
Right.
so with those, sometimes you have to be more patient. Also with Parkinson's disease as well. With the lozenge and the chew, when you're taking them orally, it could be about 2 hours. So if you're specifically taking it for chronic pain, expect a result, but do not redose it too soon. So you have to be very careful with the oral. So what you may want to have is, once you find out, your dosing regimen with your oral medicines, you can have that as your long acting and have the tincture, the drops under the tongue, as your immediate acting. So if you're, treating pain, you may have a chronic baseline pain that you treat with the long acting medicine, the lozenge and the chew, and then the intermittent increases in pain. So the acute on chronic pain, you treat that with the tincture.
Right. Now, Beverly had mentioned that her situation is neuropathy and balance issues.
Okay. So with neuropathy and problems with balance, you want to be very careful with how you dose, because you don't want to take too much THC and feel dizzy and off balance. So, what you should talk with your doctor is about the ratio of products. And so if you have something that has a lot more CBD than THC, you can get benefits in pain without getting the side effects of the THC. So that's something to stay ahead of, especially with balance problems, because we don't want you to have a problem in fall and then get a fracture. Now you're dealing with another pain issue.
Right.
And so you want to be very careful with increasing the dose and do it very gradually. I know it's kind of tough to be patient in the beginning, but if you're patient in those first few days, it'll pay off in the long run. And so, you may start with, if you're brand new to cannabis, you may start with a half a lozenge or a lozenge based on what they recommend for you, and then add the tincture intermittently. So with the tincture, knowing that it's going to help in about 20 minutes, you can take another dose of that after about 30 minutes or an hour, where the lozenge, you want to continue to wait until that, 2 hours, 3 hours for that to start helping you.
Right. Right. And especially, like you mentioned, lean towards the CBD. When you get the ratios, lean towards the CBD side. Higher CBD than THC ratios in this particular case. There. Another question that we had is anonymous question. I just started using cannabis about 4 months ago. I noticed huge improvement in my neck and nerve pain almost immediately, which was awesome. However, recently the pain has started to increase again, and I'm concerned about the long-term use, only 41, and the tolerance and dependency that I may develop. Could you speak to this? Do you want to address that? You want me to address it?
So you said they're concerned about the tolerance to the medicine?
I think they have neck pain, and all of a sudden it's starting to increase again. If I may take a moment for a second, because this falls into one of my wheelhouses. I have 7 herniated discs in my neck. I have 2 in my back. But I think I find that when I use medical cannabis, I get almost immediate relief. But I've also found that it's important that in my case, every 6 to 8 weeks, I take what I call a holiday. And what I mean by a holiday is I actually stopped using cannabis. I'd like to, ideally, my goal was to try to not stop using it for maybe 2 to 4 days, so my body can reset. Okay, that's what I'm trying to do. In my particular case, my neck pain is so severe, I can probably go a day, maybe a day and a half before I have to really start using cannabis again. Again, I'm not addicted to cannabis at all. What I'm addicted to is getting rid of my neck pain, and getting rid of that, and doing it in a way that I'm not damaging my body, or I'm not doing something that's causing some side effects that are bad for me, like you get with Percocet and other things, the constipation and things that come with Percocet. So I think what you're really looking at is after a period of time, let's say you have 6 weeks or 8 weeks, take a day, take 2 days off and let your body reset. And what you'll find when you come back is your body is much more receptive to the cannabis. Fundamentally, what's happening is my body gets lazy. And so it relies on the external phytocannabinoids rather than itself. And this requires my body to kick in and become part of the party again. I know that's helped me quite a bit with my neck pain, and it might be something that you can take a look at. I know that's out there. I wouldn't necessarily be too worried about the long-term effects of being addicted, because there is no withdrawal pains from cannabis. You're not gonna die. You're not gonna throw up. You're not gonna do a lot of things. What I have found is that when I don't use cannabis, the original reason that I was using it, which is my neck pain, comes back. My neck taps my shoulder and says, "Cowboy, you better do something pretty quick. I'm gonna let you know I'm here." So in my particular case, again, I'm not addicted to cannabis. I'm addicted to getting rid of the neck pain.
Yeah. So, what happens with certain medications, and actually this is most medications involved in the pain world, is that over time, as the receptor gets activated, so the receptor, as a reminder, is the protein on the surface of the cell. When the CBD or THC molecule attached to that, over time, those receptors they're brought into the cell. And so when the receptor is brought into the cell, they're no longer on the surface. Now you need a higher dose to get the same effect, because the receptors aren't being activated as much, because now they're inside the cell. And so tolerance is something that happens over time with any medication. And, as Marc said, taking a holiday is one way, because now when you take that holiday, the receptors aren't being activated. Now they start to be put back on the surface of the cell again. So then when you start back, the medicine is going to be more effective. The other way it can be done is you can change the medicine. So you could, change the chemovar, change the strain that you're taking. That might also help, because there's a different combination of terpenes, a different combination of cannabinoids. But in general, that is one of the tough things in the pain world, is that when you start a medicine, over time, the patient becomes tolerant. But one way to stay ahead of that is to take a very balanced approach. So don't just focus on just the THC with the medicine. Focus on different ratio of products. Focus on CBD as well, to see how that can complement. So that way you're not stimulating the receptors on a continual basis.
And don't underestimate the power of CBD when it comes to pain. I know that when I had my left knee replaced, and I had a high dose of THC right after the operation to be able to address that. And one night I ran out, and I was a little bit panicked, because obviously if you've ever had a knee operation, it's not a picnic. It's a lot of problems. And I actually took a little bit more CBD, and actually the pain went away. And I was a little bit surprised that when I went back to my medical marijuana doctor, as well as my regular doctor, they were explaining to me what I was doing was getting rid of the inflammation. And by relieving the inflammation, it was relieving a lot of the pain. Now, it didn't get rid of the pain, but it sure relieved it quite a bit. And I was really surprised how much of an effect CBD has through the condition of being able to reduce inflammation, to be able to help you with pain. I think it's something that's very, very interesting that's out there. You have some comments about that, Dr. Newton?
No, I think that's great. When we look at these, listed terpenes, it gives the patients an idea, and also gives the physicians an idea for the recommendations about how they can use the tools to help. And these are terpenes that's not only found in the cannabis, but they're also found in different foods. So you see, in other plant-based products, you see in the picture here with the myrcene, that's also found in mangoes, alpha-pinene for inflammation. Right. It's found in pine trees, and it's in aromatherapy. The carotene, which we mentioned earlier, in pepper. So these can be supplemented with your diet as well when you're taking the medication.
Sure, it's out there. One of the other questions that came up, Carolyn asked a question. She says, "I have rheumatoid arthritis. I use all Trulieve marijuana." He says, "I'm lazy to drive across town. My problem is that I can only take my medical marijuana at night because it totally makes me loopy. Not a bad loopy, but once where I wouldn't want to drive. What do you suggest during the day? And thanks for the hint about putting lotions on my bad joints." I think what happens is she's taking, there's no question that whatever she's using at night will help, but you probably need to get more of a ratio during the day of less THC to be able to function.
Right. So when we talk about ratios, what we're talking about is how much CBD there is relative to THC. So when we talk about a 2-to-1 ratio, for every 20 milligrams of CBD, there's 10 of THC. When we talk about a 5-to-1 ratio, for every 50 milligrams of CBD, there's 10 of THC.
Mhm.
Or an 8-to-1. So, there's 80 milligrams of CBD to THC. So this is what we mean when we say ratio of products. And as you increase the CBD, that will protect you from the side effects of THC, but you'll still get the benefits of THC by having that in your medication.
Right.
And Marc mentioned a product, a 1-to-1-to-1. So that ratio was more talking about a CBD delta 8 and delta 9 product. But what we're talking about here is a product that focuses on the CBD and THC. Over time, you'll develop, and you'll see what your tolerance level is. Sound like your tolerance is overall fairly low. So another way you can combat that is by starting out with short-acting medication. So starting out with the vapor pen, starting out with the tincture, which is the drops under the tongue. You'll get more immediate benefit. And then you can also see, what product is working best for you, which ratio that you need. And then at some point, when you get a good comfort level, you can have your long-lasting medicine. So that could be either your tincture, your capsule, your gel, and then your immediate,
your edibles, right?
And tincture can be either one, because it's kind of intermediate. Tincture can be your long-acting, or it can be your immediate release. So some days you might need 3 doses. Some days you might need 2 extra. So you may need 5 doses. Tincture is very versatile. Mm-hmm. That's if you don't have if you want to avoid inhalation method. But the advantage of inhalation is you'll know within a few minutes if that's going to help. It's like taking an inhaler. You see asthmatics take an inhaler, they get benefit in their breathing pretty much right away. The same thing will happen for you. If you take the medicine, you'll know right away, and then you can redose it. And so you can take that second dose, wait a few minutes, wait 5 minutes. Okay, you don't have response, you can take another dose. There is something called microdosing, where patients take a little bit at a time. With that, you have to be much more patient. In that case, patients take just enough to notice a difference. I'm not saying they get significant benefit, they just notice something. And then they wait a few hours and take another dose. So that's a process that takes a few days to microdose. But, either way, what you want to do is start low and go slow. It's good that you recognize that that's a side effect, that you can help to avoid, that you see that you have the dizziness, and then at night, where you want to go to sleep, you want something to make you a little bit more drowsy. If you have insomnia, then you can save the product for that time. Right.
Microdosing is where you take, instead of taking, for example, 1/2 eyedropper, you take just, let's say 1/5 of that, but you take it 5 times a day or 5 times a morning, every hour or two. It's very similar to the way a lot of athletes will eat 3 and 4, maybe 5 times a day rather than 2 or 3 big meals, because it just helps their body be able to metabolize what's out there. It's a very similar process. And that's what microdosing really helps you do.
Right. Yeah. And if you're having any problems with any of those products, of course, you can go back to the store, return them. And that way we can see if we can find a better match for you. You're having those side effects. Or like we mentioned earlier, have the CBD on hand, so you can take the extra CBD and already have that in your system when you're trying the next product.
Yeah, and experiment with some high CBD ratioed products during the day, especially in the morning. Be careful of the THC. That's what will make you loopy. That's what will cause the driving problems. But if you mix that with a lot of CBD, the CBD will counteract the high that you get off THC. So a high ratio, like an 8 CBD to 1 THC, might be something that you want to take a look at. But again, do that on the weekend. Don't do it, do it something where you can try it out and find out and listen to your body. Your body will tell you what works. What doesn't work. I know that I have one patient that uses a lot of actually it's a 20 to 1, 20 CBD to 1 THC in the morning helps them quite a bit to get through the day. And that's something you may want to take a look at.
Yeah, I think it worked very well. Combine that with the topical medication, the cream. I think that'd do very well.
Right, and that's what's really great about cannabis. It's very personalized. I think an anonymous comment here was they appreciated a response and said it's highly individualized, which is true. Again, listen to your body. But you asked what is a mild, a moderate, and a heavy dose. I think that really depends on the person. I tend to look at dosing in two different categories. One is how much of the product do I take? And I use a tincture drop just as an example. Am I going to take a quarter of a dropper, half a dropper, or the whole dropper? And then the other question is how much medication is in that dropper? In other words, how many milligrams of THC and CBD are in that particular product? And I pay attention to both of those. I probably pay more attention to the amount of THC and CBD than I do about the amount that I'm taking. Because once I understand what that is, then it tells me how much I should be taking. Let's put it that way. And I would say that, you know, a moderate for me is just basically the tip of the tincture drop, or if I'm vaping, maybe just one hit off a vape pen type of thing. When you talk about the heavier dose, that could be a whole eyedropper that's out there. But again, it really depends on the amount of liquid as well as, or the amount of product that you're taking, or also the amount of milligrams. In the case of edibles, it's okay to cut them in half. It's okay to cut them into quarters and try them that way. You know, you talk about microdosing, cut the thing into like 8 or 16 little cubes and really try it every 2 hours. That's an excellent way of being able to microdose that's out there. You know, break it up into small consumptive doses really help you quite a bit. There. Let's see. See, we have any other question that's here we should look at? Oh, I know here. Are metered dose inhalers available in Florida? I've seen the heading on Trulieve's site, but no product shown. You want to comment on that, Dr. Terel, Dr. Newton?
Yeah, so there's different you know, ways as far as inhalation products available.
Mhm.
With the most popular product, I would say, is a vapor. There may or may not be availability of certain products in terms of inhalation. I know there are some dispensaries that, you know, that might be one of the more popular products that they have. So you just have to, you know, check with, you know, the dispensary location.
Yeah, metered dose inhalers are available in Florida. Unfortunately, Trulieve doesn't have one in the product line right now. I mean, you had one a long time ago, but I know that I know they're looking at bringing it out again, but I don't think you have one in the product line right now.
Yeah, but when we have a big research and development team, so to have the most up-to-date answer, I would say, you know, just give the dispensary a call. There are some dispensaries that do have inhalation, so they do have the meter dose inhalers. You know, you just have to research. The thing with having your card, it gives you the flexibility to go to whichever dispensary you want. So you can go in and actually just get educated, you know, and that's one of the flexibilities that you get that's different from a prescription being sent to a pharmacy. So you can go and compare and contrast. You could get products from different dispensaries, and, you know, you can always go in and just get educated. The majority of dispensaries have some type of education process where you could go in and kind of learn about the products that they have available.
Right. Carolyn asked an interesting question. She said, I was out of town and took what I thought was my usual inhalation vape pen and suddenly had a horrible bad trip. I didn't have any CBD with me and I didn't know what to do. I heard that inhaling pepper will bring you down. Any other household remedies? You want to check that one?
I'll let you check that. You kind of hit the nail on the head earlier when we were talking about, so it's beta carotene, that's what's in pepper, and it works very similar to CBD, where it attaches to the CB2 receptors. You know, it's structurally different from cannabinoids, but from a functional standpoint, it acts like, you know, the CBD. So that's one of the methods to do that. You know, of course, the other one is if you could, you know, you are out of state, but, you know, if you could, you know, any way you can get your hands on some CBD. Marc has a great product that is available retail. He can, I think, are you going to talk about that at the end, Marc?
Yeah, a little bit at the end. Yeah.
Okay.
And we only make it available. We're not trying to compete with Trulieve. I know that a lot of people have asked, where do I get a quality CBD product? And we had some doctors recommend them and provided a site to be able to do that.
There's no reciprocity process right now. So if you're in another state, you have your card here in Florida, there's not a reciprocity process where you can just go into another, you know, dispensary. Even though you have your card here, you have to have your card in that state where you're at the time. So if you're traveling, it makes it tougher when you're out of state, you know, but, you know, when you're in state, of course, you can go to any location. We also have deliveries. You can get same day or next day delivery. But, that's one of those things that you have to deal with sometimes. And, by getting, CBD, in your system, that will help getting the, as Marc had mentioned earlier, with the cracked pepper. The other thing is to, relax, take control of your breathing, try to put yourself in a meditation type state. If you feel really anxious and have palpitations,
Right.
I understand it's a very unpleasant experience, but patients don't die from that experience. It's just something that's, very uncomfortable, can make you feel paranoid, but it will subside over time.
Right. Right. And again, the cracked pepper is probably the as far as a household remedy, the one that I've heard. Water, I've heard drinking a lot of water helps quite a bit. And then I think the other is just relax.
Well, it may not be that bad of an experience if you get some lemon pepper wings and just put extra pepper there. So, but you have to wait when it's oral.
That's true. That's true. That's very
Or
true.
ghost pepper.
Well, we just got an interesting question. Does marijuana help with asthma?
It's not a qualifying condition in Florida, but it does help because there's anti-inflammatories, specifically, alpha-pinene, CBD, beta-myrcene. So it can help, but it's not one of the listed conditions for Florida.
Sure. Yeah, but I think from the standpoint of being able to help, the answer is yes, it does. It's just not, you're not going to get a medical marijuana card because of it. But it is something that if you have asthma, it's something to clearly take a look at. And I know a lot of people have shied away from cannabis because they perceive it to be smoking a cigarette, smoking a flower. And with asthma, they're a little concerned about that.
Yeah,
where I think that when you take a look at the various medical, I'm sorry, go ahead.
I was going to say, in the early 1900s, we actually used tinctures to treat asthmatics. And so, the tinctures, the drops you can take under the tongue or take orally, that was one of the conditions where cannabis was prescribed. This was back, in the period before prohibition.
Right.
Asthma was one of the listed conditions. And, it's the alpha-pinene, is one of the things that's a bronchodilator and also works very well for inflammation.
Sure. Sure.
So that's one of the, if you're treating another condition, this is one of the things that you can look and see the certificate of lab analysis, get a product that has the alpha-pinene. So that way it's basically a positive side effect, but it's not a qualifying condition for Florida.
Now you mentioned terpenes. I have a slide up here on terpenes. We've kind of gone through them. There's over 200 terpenes that they've identified, probably less than 40 of them that they really effectively studied, but they really bring the personality of cannabis out in many cases. Myrcene, for example, is something that's really, really interesting as a product. And I took a product about 3 years ago that was really good for pain when I was dealing with my knee. And I found that same product came out and it was designed for sleep. And I remember talking to it wasn't Trulieve, it was another dispenser. I said, what's going on? And they said, well, we have one that's high in myrcene and we found out it's really good for sleep. The only difference was the terpene profile, which I found absolutely amazing. It does really have a big effect on what we call the fingerprint of that particular product that's really coming out. And you mentioned a few other terpenes like limonene and linalool that has helped, right?
Yes. I love the terpenes because this is the personality of the plant. This is the colors, the flavors. This is what gives cannabis the variety of what patients can get. And so this is where you can get some pleasure out of taking your medication. And so, for example, we look at linalool, we want to take something to be more relaxed, but you don't want to be completely asleep or couch lock. Just adding linalool or changing chemovars, changing the strains that you take. If you take one with more linalool, you can feel more relaxed without necessarily feeling sedated. Now, if you start taking higher doses of THC and CBN, those are things that's good for sleep. So they can combine with linalool to help you sleep. And, sometimes you may want to have a more potent effect. Sometimes you may want to have a more mild effect. And so with the terpenes, they allow you to basically get that entourage effect where you can get slight alterations in the CBD and THC and how they work by combining them with the variety of terpenes. So it's one of those things that there's more research that's evolving. I think I mentioned earlier about the research with D-limonene and cancer. There's also some current studies going on with myrcene as well. And so they individual cannabinoids are also looked at in terms of research studies. And this is a way that you can take your medicine and then supplement that. So if you need some extra, strength to your cannabis strain, you can add myrcene in the form of mangoes as food, or you can add, aromatherapy with linalool if you want to feel more relaxed. But it gives you a much milder effect compared to THC and CBD and the other cannabinoids, but it does contribute to that entourage effect where you get a more mellow benefit.
Yeah. And terpenes are very, very important. And if you're wondering what terpenes are in the products, ask the bud tender. Ask when you're at the store, ask them. They'll tell you exactly what's in the products that are out there. Now, we also talked about, I'm sorry, you had a comment?
No, I was just going to reiterate from earlier that, the terpene profile will also be on the QR code on the product. Yeah. So that way you can confirm. So for example, if the patient is being referred for cancer and they want to make sure that they have terpenes that have been shown to reduce the spread of cancer, then they can check the QR code on the product to see what's in there.
Right. And here's a list of the different cultivars and the terpenes for pain management that you might want to take a look at. Again, available from Trulieve. Anonymous asked the question, Doctor, what would be the indica or sativa for asthma?
Yeah, so, let's look at this list here. So, so they said, what would be the indica or sativa?
Yeah, indica or sativa. I think
it doesn't
indica
matter.
and sativa really are more leaning towards the tendency than anything else now.
Well, I would say it doesn't matter if it's indica or sativa. What matters is, the CBD, the THC, and the terpenes. So with asthma, you're looking at this profile. So let's just go down a list and see, okay, what has alpha pinene? What has CBD? So this first one, ACDC. Again, we're not treating asthma with the medicine. It's just a positive effect that it helps with asthma by reducing the inflammation, and also by being bronchodilators. For example, the alpha pinene. So that first strain that's listed, ACDC, that would be one that's prone to help. Looking down, the third one across also has alpha pinene harlequin. That would be one that's prone to help. Going down further, you see at the bottom, CBD critical mass, that would be one that's prone to help. And it also has THC and CBD. So they're working synergistically to reduce the inflammation.
Right. And I know that in talking to a number of vets that are dealing with pain, Master Kush is their kind of their favorite strain. I know that's something that's there. And again, it just comes from their own personal preference more than anything else.
Master Kush is actually one of my favorites as well. It's gives you the best of both worlds. It's THC dominant, but it can also help with PTSD and other conditions where the patient's dealing with very serious issues. So right. Yeah, it's one of my favorites as well.
Well, we've covered a lot on pain management. Let's talk a little bit about Trulieve. I put this picture up because I know a lot of people perceive, we talk about dispensaries and cannabis, they think that a lot of these stores are like head shops, and when you go into a Trulieve dispensary, you're going into something that's more like Macy's or more like an Apple store than it is a head shop that's out there. But more importantly, you have a number of different products that fit in all the categories we talked about, right?
Right. So, there's, some of the most popular products there, which are the edibles. And so we have, different True Gel products that's available for patients where the medicine actually tastes good and it's very effective. And, as we mentioned earlier, you may want to start with a half or a quarter dose and basically work your way up from that. There's also, chocolates and brownies that's available. And these oral formulations are very good because with these are medicines that tend to be longer acting. Looking at the next row there, tinctures that we're talking about ratio products. So these are drops that you would take under the tongue. We have different topical products, for rheumatoid arthritis, for muscle pain as well. Rosins, now we're starting to get into more of the concentrated, the more experienced patients, some that they would use. There's also RSO, Rick Simpson oil, that's a concentrated oil that's often taken by cancer patients. And so cancer, you need a much higher dose because in order to, penetrate the area where the cancer is spreading, you need more bioavailability. So you need a higher dose to get into the bloodstream, a higher dose to penetrate to where the cancer is. And research studies have shown that the way the cannabinoids work in that instance is reducing the blood supply and the spread of the cancers. Then you have vape products, and you're going to get a faster onset with these. So these will work within 1 or 2 minutes. And so you get a much faster result. You get more of a rapid onset of relief.
Yeah. Also, you take a look at you have a thing called your nanotechnology. What you've done is you've been able to break the particles down into really smaller particles called sonification, which makes it easier for your body to absorb them.
Right. So with anything, you know, when you're talking about, whether you're talking about oil-based or water-based, molecules have a tendency to stick together. And so with nano-based technology, we're kind of separating those. So now they can be absorbed much more readily and much faster. So you're basically getting more for the amount of medicine that you're taking. You're getting higher bioavailability. Sonication is a process that uses ultrasound waves to kind of break things up and separate the products. And so with this, you're getting a much better amount absorbed with a lower dose of medicine. Yeah. And so there's some of the products there, the True Nano Tincture, and then the True Nano Gels as well. And we talked about the ratio of products earlier, the 8-to-1, the 1-to-8. So we're looking at CBD to THC product. That 1-to-8, that's going to be, you know, your more experienced cannabis users that might need a higher dose of THC on a regular basis. This is especially for, you know, like athletes that's dealing with chronic pain, football players, basketball players dealing with chronic pain and knee issues. And then you have, you know, some more of our ratio products, the CBD to THC, and then the THC to CBD products. Right. And with the oral medicines, if you go back to that, the True Gels for that, right? Yeah, right there. Perfect. No, back to the other one. Go back to the other slide for a second.
This one? This one?
No, go, I'm sorry, go forward. Go forward. Yeah, right. Perfect. Right there. So I just want to show this here, the True Gels. There's a variety of ratios that's available. So for a lot of patients with some degree of experience with cannabis that know that they can tolerate it orally in a vapor form, 1-to-1 is a good place to start where you have more experience. Then over time, if you need to increase that, you know, THC and CBN are both going to give you a relaxing effect. They're both going to help with sleep. So that's where you would take a product maybe an hour or two before you're ready to fall asleep. Right. And then we have the 1-to-1 CBD, CBN. For some patients, CBN is going to be a little bit milder than THC. It just really, every patient is very different. And these are the products that are going to be more your long-acting medications.
Mm-hmm. Right, that are there. And then, of course, you have the vape pens that are up here. And we mentioned the 1-to-1 to ones. This is 1 Delta-8, 1 Delta-9, and 1 CBD right now. And I know they're pretty hard to find because they're very popular. I think they're almost impossible to find in the stores, not because they're not good products, but because just to get supply and demand, keeping them there is a problem. So let's talk a little bit about your discounts. I mean, everybody, you know, one question that came up, Anonymous asked, what's the cost? Obviously, the best way of looking at the cost is go to the website. It'll tell you all the products and the costs of each of the products that are there. That's what I recommend, the best thing to do. But also, you have a lot of discounts. You have loyalty programs, veterans programs, birthdays.
Right. And patients can sign. I think it's good to sign up because you'll get alerts when there's different promotions, different products. You know, even if you use a different dispensary, if you want to price compare to see what's going on. This is not covered under insurance, unfortunately. But we try to keep a variety of discounts. You know, there's first the new patient discount, which is 50% off. But then when you get your second order, you get 15% off. We have another discount is if you bring a patient, you'll also get a 50% off another visit. So that's like a referral program. And then for your state ID card, you'll get 75% off with a purchase of 150 or more. And you can also exchange. As far as I know, we're the only dispensary that does that. If you have a product that's not working well for you, you can bring that back to the dispensary and do an exchange, and we can see if there's a product that will work better for you.
Yeah, that's an excellent point. If you have a product that's not working for you, even if you've used half the bottle, you can bring it back to Trulieve and they'll exchange it. And I think that takes almost I know everybody's worried about costs these days and what things cost for you. And I think that helps be able to get the right product at the right cost. Now, don't abuse it. Obviously, don't try to use half bottles and try to, but it's out there because they do track that. But I think the fact that you do have some capability to bring it back and to try different products and really hone in on it, I think that's a huge advantage of working with Trulieve.
Yeah, and a lot of patients are also taking advantage of the True Perks programs and other different specials that we have here, where they'll get a stamp, and then after 9 stamps they'll get 50% off. So it's one of those things that we're trying to really help with this not being covered by insurance.
And sign up and get either the text messages or the emails, because Trulieve has some incredible discounts that you offer almost on a bi-weekly basis. So it's kind of like, pay attention to it. It's kind of like going to like a public shopper. Pay attention, you'll be able to see some interesting things that are there, if for the cost conscious.
Yeah, and on top of that, the delivery program is excellent. So it's free delivery for all patients over 65, and for patients with a $200 or more purchase. And there's same day and often next day deliveries as well. You can also order and have your order picked up. So you could do, sign up for the online purchase program. And it's really great and convenient that patients don't even have to leave their home to get their medication. Right. They can just set up delivery and just come pick up their medicine.
Yeah, I mean, in the worst case, the delivery cost is $15, which is the lowest of any of the dispensaries in Florida. That's the first thing. But I think the fact if you're a senior, you can get deliveries makes a big deal. But I also like the fact that if I'm going to be driving by the dispensary and I place an order, with my phone, you get an email, or excuse me, a text message. I can click on that. It can put me in line. So when I show up at the store, I actually walk in and get my product, which I think is a great product, great program. It's there. I don't think we have any questions. Wait a minute. There's one here. It says, I live in Georgia. I have no success in finding a doctor. I'm not sure we can help you much in Georgia. I think Georgia doesn't have a medical cannabis program, or they have a medical cannabis program, but I don't think they've rolled it out yet. Is that correct, Dr. Newton?
So for there, I mean, if you do come to Florida for 31 consecutive days, and have a residence here, you can become a patient. If you're there in Georgia, they have the card system set up. It's just a matter of time until the dispensaries are set up. We actually were working on that process. Mm-hmm. So what I would recommend is if you maybe give us a call or email to the customer service and just ask them, can they add you to a list to get more information? So once we're set up there in Georgia, everything we'll have a list and see if we can get you that information, give you an update.
Yeah, I think Georgia's kind of a work in process right now.
What do you say?
So Georgia's kind of a work in process right now.
It's a work in progress because they set up the card system, but didn't set up the way for patients to get their medicine. It's like, their program is kind of, in a transitional process. Right. But, hopefully, fairly soon they'll come up to speed. But if you give us a call, just let someone know that you want to be on that list to get more information. Right. Because we are licensed there in Georgia, that they can provide that information and give you some updates.
Right. And I think that as they provide that information, you'll find more doctors will be available. It'll be easier to find them at that point in time. And I think Trulieve has on your website, you list doctors, so that as that program gets put together, you can go to the Trulieve website and probably find a doctor in Georgia at that particular point in time. But again, it's a work in process right now. So question then becomes, okay, we had one other question. Pippin, Carrie asked the question, can I get a copy of the slides? And the answer is yes. You'll get an email that'll have a link and you'll get a copy of the slides in Flipbook format. You'll be getting that in the next day or two. But also, Carrie asked the question, I'm not aware of True Perks. I have numerous purchases since April 1st to now. Can I get retroactive stamps? Can I go in and do that? I think there is a process where if you bring your receipts, or candidly you go in and talk to Trulieve, they know what you purchased. They will backfill on that, to my knowledge. Is that correct, Dr. Newton?
Yeah, you would have to, what I would just suggest to do is go ahead and, next time you do your purchase, just to try to bring all your information with you. Right. They will also have it there on file because all purchases are recorded, and but just bring everything with you and ask them those details about if they could do that for you.
Sure. And I think we're going to wrap this up by talking a little bit about, we talked about dosing, we talked about going low and going slow. I think this is very much like alcohol and caffeine. I think a lot of people think that cannabis is unique. It really isn't. I wish I knew about go low and go slow when I was in college, learning about alcohol. It saved me a lot of pain and aggravation, that's for sure. But I think that being able to try a little bit, find out what works, listen to your body, I think is important, will help you be able to find the right dosing formula for you.
Yeah, we had a patient that asked earlier, she was rheumatoid arthritis patient, was dealing with some dizziness, felt off balance, didn't feel safe driving because of the THC side effects. The other thing to, think about here with regard to your sweet spot is CBD is a weak medicine. THC is very potent. So in general, you can escalate the dose of THC much faster than you can escalate the dose of CBD much faster because it's weak compared to THC. And that's why you saw so many products where CBD is much higher than THC. And that's very good for beginners. And so your tolerance to CBD is likely very high, because it's very weak compared to THC. Your tolerance is expected to be much lower.
Right. They're there. So let's talk about the bottom line. I think there's a couple of things that are important. One of them is you're not going to get addicted. You're not going to die from it. Nobody's ever died from the use of cannabis, both medically and recreationally. And it has the benefit of the Entourage Effect. What's your gut feeling?
Well, I mean, addiction is more of a personality issue. It's, there's certain personalities where someone is prone to be addicted, whether that's addicted to sugar, addicted to caffeine, you see, sex addictions, anything online, addicted to the cell phone, addicted to social media. That's more of an inner thing. It's nothing about the medicine that promotes addiction. Someone could look at cocaine in a room and not care about it and want to be away from it. Another person, it excites them. And that's a personality thing. It's more internal. Right. So with addiction, there's multiple studies that show cannabis is less addicting than opiates. And so this is one of the reasons why, physicians like myself and a lot of other physicians in the pain world really promote this as an option for patients, because you're less likely to be addicted with this compared to medicines that's already available to be prescribed. True. And as we mentioned before, you can't overdose because there's no receptors in the brainstem. So we can't suppress your breathing. So this is safe, much safer for people with sleep apnea and other types of sleep disorders. And as we mentioned earlier, the Entourage Effect is where you combine cannabinoids, terpenes, and flavonoids. You're combining low dose medicines and a lot of them to get a very strong benefit with low doses of medicines.
Right. Well, Dr. Newton, we've been at this for about 2 hours. We still have a lot of people that are watching, and thank you very much for the folks that have stuck around. I hope that you have got something out of this that can help you. Again, our goal is if we can have just one person get their life back, we think that we've accomplished what we want to accomplish. But what we want to accomplish for you is to be able to have you be able to take your medical condition and be able to get it addressed and be able to get it, hopefully get yourself in a better state and get your life back. So thank you very much. Dr. Terel, do you have any final comments?
Well, I just want to mention, working with Trulieve, we do have some physician education that is ongoing. So if there's any physicians watching, we can get you signed up for Physicians Connect, which will be May 31st. Also, I'll be speaking at a conference in Orlando, Florida Medical Conference in Exposition. So that'll be at the Rosen Hotel in Orlando, Florida, and there I'll be presenting terpenes. And so I'll be talking about some of the latest research for the qualifying conditions there.
And when is that conference?
That's, I believe it's June 4th.
Okay.
June 4th in Orlando at the Rosen Hotel. And then we have an event coming up, don't we, Marc? Don't we have another presentation coming up in the next?
Yes, I was going to mention, you stole my thunder here. We have our next medical marijuana and wellness webinar next week is on arthritis. We'll be doing that one. And then the week after that, we'll be talking about sleep and insomnia. So we're kind of going after the different medical conditions.
That's kind of funny that you said I stole your thunder. One of my nicknames is Black Thunder.
I love it. I love it.
And how about at the next presentation, I'll tell everyone another one of my nicknames. But one of them is
I'm looking forward to that. I also want to know how you got the nickname. So you not only have to give me the nickname, but how you got it.
I'll tell you that on the next presentation.
That sounds good. But Dr. Terel, thank you very much. I don't know if you have any closing comments, but thank you for joining me and the great contribution you've made to the conference, to the webinar tonight.
Yeah, I just appreciate everyone attending, and thank you. I know it's kind of a bit of a marathon, like drinking through a water hose, but I hope that everyone learned something, had their questions answered, and please attend the next one. Come with your questions. We just want to educate you, help you, empower you to use cannabis to the best of its potential.
Yeah, and I know that a lot of people asked about, can I see a copy of the presentation? Lee posted in the chat, there is a link to be able to pick up the flip book for this particular webinar. It's available now if you want to be able to pick it up. Pick that up out of the chat. And also, I think that it's something that if you do have any questions or follow up, please let me know at that event at marijuanaaware.com. We'll be able to answer that. And again, thank you everybody for attending. We really appreciate your patience and hanging in there for 2 hours. I know it's quite a bit of information. It's like drinking water out of a fire hose, but you will get an email with the link to the video, a link to the presentation, a link to the resources, a lot of the slides and things that are there. And Dr. Terel and Trulieve, thank you, or Dr. Newton, thank you very much for your contribution. You've helped quite a bit. Now, I'm looking forward to finding out about the nicknames, though.
Okay. All right. We'll talk to you soon.
Okay. And everybody, thank you very much. Please be safe and join us next week for arthritis. And thank you very much for joining us. We much appreciate it. Have a good evening.